Welcome to the Strong Women's Club, episode number 97.
This is the Strong Women's Club, where successful women share their behind-the-scenes stories of how they got to where they are today. Join us.
Hi, everybody. This is Edie Berg. Welcome to the show, and thank you so much for joining me. Today's show is all about breast cancer, and our guest, Andrea Wolf, is the CEO of the BREM Foundation, which is a nonprofit organization committed to breast cancer prevention through early detection. So today's show is, we're going to talk all about breast cancer, what's important in early detection, how to screen, what's important to do when you're screening, what breast density is. And we're going to talk a lot also about the BRCA gene. In the U.S., breast cancer risk is slightly higher among Jewish women than among other women. And I got this information off of the Cancer Institute's website. This increased risk is probably due to a higher prevalence of the BRCA1 and BRCA2 gene mutations in Ashkenazi Jewish women from Eastern European descent. So these gene mutations are rare in the general population. In the U.S., between 1 in 400 and 1 in 800 women have the BRCA1 or 2 mutation. However, in Ashkenazi Jewish men and women, about 1 in 40 have the BRCA1 or 2 mutation. And about 10% of Ashkenazi Jewish women diagnosed with breast cancer in the U.S. have this mutation. So not all of them, only 10%. But it's still a lot higher than in the general population of women and men in the United States. Andrea herself had prophylactic breast surgery, and she tells us why she had it, what her family history is. She tells us about what the recovery is, how long it took her to get to be able to run after the surgery, and what full recovery looks like, and how it really is a personal decision and a personal journey, and how everybody heals differently, of course. So we talk all about that. And Andrea really talks about how she and the BREM Foundation are helping women become their own best advocates so that they can take control of this disease. So now let's listen to my interview with Andrea Wolf. Enjoy. Andrea Wolf, thank you for coming onto the Strong Women's Club podcast. What a pleasure to meet you, and I'm glad our tech is working. So we're going to have a great talk today.
It's a pleasure to be here. Thank you so much for having me.
Yeah, my pleasure. So we're going to go straight into your work, because this is your work and your life and everything is all kind of mixed in together. So let's talk about the BREM Foundation and what it is, how you started it, and then we'll take the conversation from there.
Sure. Well, so the BREM Foundation is a breast cancer nonprofit. It's committed exclusively to early detection because breast cancer is a curable disease when it's caught early and not as much at later stages. Actually, when breast cancer is discovered at stage 0 or stage 1, it's over 98% curable, which is better stats than the common cold. But in stage 4, as a metastatic disease, it's only 22% curable. So it's really a very big gap. In 2016, 40,450 women in the United States lost their lives to breast cancer. And we're really dealing with a disease that we have the education, the technology that we need to really make that a thing of the past. So that's what the BREM Foundation focuses on. And we do it in 3 ways. We do it through education, access, and physician training. But before I get into the details of what the BREM Foundation does, it might make sense for us to talk a little bit about why I'm doing it. Does that?
Yes. Of course, this is exactly what we need to talk about. Why you're involved, and exactly, this is the perfect place to start.
Okay. As many people do, I came by my work in this sector through a personal connection and a personal story. And it started with my grandmother. My grandmother was an Israeli woman who came to the United States when my mother was 3 years old. And when she was 33 and my mother was then 12, she was diagnosed with breast cancer. And this was in 1970. And they said to her, basically, you're going to need some radical surgery, but you should wrap your things up because you have about 6 months to live. Wow. And she had a 13-year-old, a 12-year-old, my mother, and a 5-year-old at home. And so that's what she did. She went and she had radical surgery because back then they didn't have reconstruction. So it really was a mutilating process for a beautiful 33-year-old woman. And she thought her days were very numbered. The end of that story is that she lived for 43 more years.
Oh, how wonderful.
But and she did actually subsequently get ovarian cancer in her 40s and was told the same thing and then continued to fight on. But it had a profound impact on my mother. As I said, my mother was a young girl. And because of that experience, my mom went to medical school and then went into radiology and became a breast imager herself. And she had me and then my twin sisters. So she had 3 girls and was a clinician scientist, was practicing medicine. And in the early mid 1990s, they discovered the BRCA gene, which is a genetic mutation that predisposes people with that mutation to much, much, much higher incidences of breast and ovarian cancer. And she was a good candidate because her mother
had both.
Had breast cancer in her 30s, ovarian cancer in her 40s. It's usually much earlier onset. And so right after the gene was discovered, she got tested and she was positive. And she actually scheduled prophylactic mastectomies, which back then was considered really crazy. Nobody was doing that back then. Now it's very common.
But it's still a very difficult decision to do. People have at least heard of it.
Exactly, for sure. But she said that she was sure she was going to get breast cancer and she wanted to do it. And so she scheduled them. And one thing she used to do as part of her practice was she would test out new equipment before deciding whether to buy it to test the image quality for her patients. So after they would go home, she would test it out on herself and then decide whether it was good enough for her practice. And so one night when she was doing this, about 2 weeks before her scheduled surgeries, she found 2 things. She found the imaging equipment that she wanted, and she found her own breast cancer.
Wow.
So she was a bit, a day late and a dollar short on that. She was 37 years old and I was 12. So here we go again with history repeating itself. She had multiple surgeries, chemotherapy, whatever it is that goes into, treating breast cancer. That's what she did. And she shielded me from it, and, our lives went on. Everything was fine. She's 21 years out and she's doing great. But growing up, I knew a lot about breast cancer. I heard a lot about it because it was what my mother did for her profession and she included me in her life. And I knew my grandmother and I knew my mother, obviously. And, they both were doing great, but I was aware of what had happened. Mm-hmm. So at age 22, I got tested for the BRCA gene because I was a good candidate. Mm-hmm. I had the mutation and I made a commitment to myself to do everything possible to change this narrative, to change the pattern of women in my family getting breast cancer in their 30s. Mm-hmm. I had my first daughter, Eliana, at age 24, my second, Liron, at 28. And then when I was 30, I had prophylactic mastectomies. And my pathology came back negative, and I felt very blessed. And I did 2 things. I had a third daughter, and I joined the board of the Brem Foundation. And the board said, we've been all volunteer. We really need somebody to lead this. Can you find somebody? So I interviewed lots of people. We started to do a national search, and I just went to bed every night and thought, why am I not doing this? So I left my job as a lawyer in the policy world, and I'm now leading the organization. And it has just been a fulfilling, meaningful experience every day since.
Okay, so this foundation was in existence, and your family, you are now the CEO, right? And the executive director, I guess.
I'm the CEO, yes, that's right.
Of this foundation.
Okay, so my mother is Rachel Brem. So it is named after my mother. Okay. It was actually formed by a group of grateful patients who were inspired by the way she practices medicine. She is a zealot for early detection, and she treats every patient like a family member with intense compassion and care. So, it was a way to push her philosophies and approaches to early detection. And, a nonprofit was formed through that.
Mm-hmm, I see. And what about your sisters?
What about my sisters? We have a code of silence about my sisters. But,
okay, sorry.
We are a very, very close family. And, I've gotten amazing support through the whole thing.
Okay. Do you mind talking about your surgery a little bit and this decision and what the whole process is? If somebody, I mean, because many with Jewish women, and this program is aimed at Jewish women professionals, all ages. My best girlfriend has the BRCA gene. She had her ovaries removed, but she has not had breast surgery. But she has certainly considered, I mean, she's older also, she's almost 50. So, I mean, it's a whole different thing for her, right? But on the other hand, my first cousin does not have the BRCA gene, but she was very, very recently diagnosed with breast cancer. And I don't even know what stage, but it's in her lymph now. So it's touching our lives every which way that you look at it. So if you don't mind talking a little bit about the process of making the decision and the actual surgery and what that means to have that done.
Sure. As Jewish women, you'd be hard pressed to find anybody who hasn't been very closely touched by this disease. The prevalence of the BRCA gene in the population generally is 1 in 400, and in Ashkenazi Jewish women, it's 1 in 40. So it's a huge difference. In terms of the decision itself, you made the most important point earlier, which is that it's very personal. It's irreversible and it's personal. And for me, it was a pretty clear path. I had, knew about my grandmother. I had watched my mother go through it. I knew that I wanted to do everything possible to not have that happen. And I was given two options. I was given the option of surgery and I was given the option of surveillance. And surveillance means a lot of very close monitoring with excellent technology, but it means that you're waiting and watching. It doesn't mean that you can prevent it when it happens. It means that you're ready to deal with it when it does come. And so for me, I knew I wanted to have surgery. Like I said, I was married with 2 kids. I wanted more children and I didn't want to have to worry about this anymore. And I was worried about it. And so the surgery itself, there are a lot of different types of surgeries that one can have. There are surgeries with implants. There are surgeries without implants. There are different, stages of reconstruction. I chose to have implants. I have silicone implants, and I chose to have one surgery, not multiple surgeries for different stages of reconstruction. I had little kids at home, and I wanted to do it and be done. But like I said, this is not a right or wrong decision. It's a very, very, very personal decision,
Sure.
and it is irreversible, right? You can't wake up from that and say, "Oh, I wish I want them back," right? I can't change my mind. But I have to tell you, short of the decision to marry my husband, it was the best decision I ever made because the peace of mind that I have, I still feel feminine. I feel beautiful. I feel proud. I'm able to move forward and, I play with my kids and I run every morning and I just feel
It
great.
feels very natural, I think.
Oh, absolutely.
I think, how long is the recovery? Say you have the surgery. How long did it take you to recover from the surgery? Like the whole process?
So I was walking around the block 3 weeks later, but I'd say fully healed, recovered, settled, 6 to 9 months.
Okay. So that's doing sports and that's lifting your kids up and.
Exactly. I was running again, I'd say 6 to 8 weeks in.
Okay. All right. So that's a really good indicator because I think 2 months of, the hard, like you said, it's like up to about 3 weeks of pretty intense, just being in bed and just really recovering from real surgery and drain.
I'd say a month. Give it a month.
All right. So I don't want to. I'm just trying to have a realistic picture of so when people can listen, they know exactly what to expect. I mean, this again, it's personal and it's you. Each person, they react differently and they scar differently, and everything is different. But
yeah, I would say there is no exactly what to expect.
But still, but
my type of surgery was different because if you don't have implants, you can have surgery where they take tissue from other parts of your body and use that instead of implants. And that recovery is much longer and much harder, but you don't have to deal with implants.
Right.
So it really depends on each person and how they heal and stuff like that.
But then that's behind you. You've done it and it's done and like you said, okay. So and also I think of course after Angelina Jolie decided to do it, I know that I mean, she's only a celebrity on the one hand, but on the other hand, she's a pretty major celebrity and really did raise awareness for this exactly the same cause, and people look up to her.
So actually, it's funny you should bring her up because she had her surgeries 3 months after I had mine.
Oh, really?
And when that big New York Times article came out, my husband ran into the room and he said, "Look, another beautiful young woman just followed your lead." So I said, "Yes."
Right.
It was very sweet and it was very funny. But yes, she did.
It makes a difference.
Shed a lot of light. I think she is an amazing person for being as public as she was. I think she did a lot of good for a lot of people. And for me personally, the timing was very funny because it was right after mine. So it kind of was very, personal and public both at the same time. So it was kind of neat and just coincidental.
Yeah, of course. But that kind of thing, even though we kind of always scoff at celebs sometimes, but sometimes they do good work. And I think this is one of the times to make it okay for people to be talking about it, people, to make decisions about their own bodies and not just be passive in a situation like this. So what do you do at the Bram Foundation?
So the Bram Foundation is, like I said, focused on early detection, and we do it in 3 ways. We do it through education, access, and physician training. The education is based on the premise that breast cancer is a really well-marketed disease. You'd be hard-pressed, at least in the United States, to find anybody who doesn't recognize the pink ribbon, and there's pink and pink and pink, and every day there are breast cancer stories in the media. And yet what we noticed was that women really don't know what they need to know about their risk factors, about their screening options, and about how to advocate for themselves when it comes to breast cancer. So with all the attention and all the talk, what the Bram Foundation does is whittle it down to a very practical education about what each woman needs for herself. And it's not a one size fits all. So what you need and what I need and what another woman needs is going to be based on the risk factors that each one of us has and the screening options that each one of us has. It's not just a mammogram and done. It really depends on who you are to maximize your opportunity to find that early curable breast cancer. So we have a comprehensive educational program that teaches women, about their risk factors, about those screening options, and about really how to advocate for oneself in getting the optimal breast care so that you can find an early curable breast cancer rather than a later stage less curable breast cancer. But we also noticed that education is only as good as the tests that a woman can access. And so there's a whole cohort of lower income women that were having trouble with that. And I'll explain what I mean. A screening mammogram is generally free, but a screening mammogram doesn't tell a woman whether she has breast cancer. It only tells her whether she has an abnormality that requires a diagnostic test to determine what that abnormality is. So there was a whole cohort of under-resourced women who were getting free screening mammograms, which is the right thing to do, and then being told, "Hey, Mrs. Johnson, you have an abnormality. You're going to need, let's say, a biopsy." And then Mrs. Johnson is stuck. She's stuck because she can't afford a biopsy. She can't afford her deductible, or she doesn't have health insurance, or whatever her situation is. And so the Bram Foundation funds diagnostic tests for women who can't afford their diagnostic tests after an abnormal screening mammogram within 2 weeks of that screening mammogram. So that those women have a path forward. And it's really agony for a woman, regardless of whether she has breast cancer, to be told that she might, because everybody assumes that they do.
Don't know.
And then being told, "I'm sorry, there's nothing you can do about it for 3 months, 4 months, 5 months, 6 months, ever." That's horrible. So the Bram Foundation does fund diagnostic tests for lower income women. And the last pillar of what we do is around physician training. So physicians are a linchpin in the process of early detection. And we fund the only breast imaging fellowship in the country that not only teaches young doctors about the most cutting edge techniques in breast diagnoses, but also requires that they go into communities and educate women and treat a significant number of lower income women in their practices. And this inculcates a culture for their entire professional lives of commitment to under-resourced communities and understanding the value of public education in preventing later stage breast cancer.
Fantastic. So you're based in Washington, D.C.
Yes.
And so all of this education, it happens in your clinic. Is it what, I don't know. Do you have a clinic, or is it a separate hospital?
No,
So
we
what is
don't
it?
have a clinic. We
Mhm.
go to churches, shuls, rec centers, preschools, wherever they will
Mhm.
have us, and we
Mhm.
educate women from all backgrounds, all ages, all nationalities, everything, because breast cancer doesn't discriminate, so we can't discriminate. And so, the education right now is all in person. But we are working on digitizing that education so that we can expand significantly to communities that aren't in the region or in the vicinity.
Mhm. Okay, fantastic. I'd be interested to get some of this. I wonder what's going on in Israel with the. I told you before we started recording that my husband's also a radiologist. He doesn't do women's imaging, but he's an interventional radiologist. But I'm interested. Do you know anything about work like this in Israel?
Well, so actually, my mother is very involved in the breast imaging community in Israel. She organized the first and largest mammography conference that goes on in Israel. So there is a lot
Really?
of work being done in Israel.
Mhm.
I personally am not super familiar with the on the nonprofit side, on the education side of what's going on. I would
Mhm.
be thrilled to be more involved in Israel and would love opportunities to educate more women in Israel. Because as you pointed out, for Jewish women in particular, this is a key issue. I do know, as do most people, that Israel has fantastic technologies, and that I think a more comprehensive education about risk factors and screening options
I
might
think
go a
so too.
long way in Israel.
And I think also here, not many people are doing prophylactic surgeries. I think less so than in the States.
I mean, it would be something that we are not involved in right now, but I would be thrilled to become more involved. So if there are opportunities, please reach out to me.
Mm.
I'm happy
So
to
when you
give
come
contact
here next time, because
information.
as I said, like,
Yes.
so definitely set that up, because we're very involved here, with everything radiology, As- so so that would work out really well. That happens to work out really well. So let's talk just a little bit before we finish. To women who are listening now, wh- maybe give us a couple of pointers about self-exam and things, like how often we're supposed to be doing it, and just a little bit of practical tips for us to take away from today.
Sure, absolutely. So, self exam is a good thing, and you should do it. Self exam is free and easy, and you can do it at home. It should be done every month, and there are resources that I'd be happy to send regarding how to do it. I don't think this show is the place to get into details of what to do, but there
Mhm.
are plenty of online resources. But what I would really like to stress is that there's been some confusion around the guidelines of when women should get screened for breast cancer. And I want to say that women of average risk should be screened starting at age 40 every year, not every other year,
Mhm.
not changing based on age. And that's, like I said, women at average risk. Some women who are at higher risk need to start screening beforehand. And that screening needs to be based on those risk factors. And some of those risk factors include family history, genetics, but also breast density. Breast density is a big topic that the Brem Foundation focuses on. Breast density is the ratio of fat to connective tissue in the breast. And in the overall population, about 40% of women have denser tissue. 67% of premenopausal women have denser tissue in their breasts. Well, what does that mean? It means that those women are at about 20% higher likelihood of getting breast cancer. But those breast cancers are much harder to see on a regular mammogram. So
Mhm.
women with dense tissue need to have an ultrasound in addition to their mammogram to be able to see those cancers, because dense tissue on a mammogram looks white and a tumor looks white. So there's very little contrast. And so how do you know if you're dense? You know by asking when you go for your first mammogram. You can't tell by touching, feeling, looking. You can
Oh.
be saggy dense or perky dense or big or small. It's
And
all
also, it's yours. Yeah, I mean, most people, they only have experience on themselves. They don't. I mean, like, they're not going around touching
right.
everybody else's
Exactly.
boobs. So
Exactly.
what?
And you
So you
couldn't
don't
even
know
tell
any
by
different,
touching
even if
anyway.
you did.
So
Okay.
you need to ask when you get your mammogram, you need to ask, do I
Hmm.
have dense tissue? And does that mean I'm eligible for additional screenings?
Hmm.
So I would say know your risk factors, know your screening options, and know your rights. The Brem Foundation has something called the Breast Health Bill of Rights. And it's 8 rights that every woman has in her breast care, including things like asking who's reading her mammogram. Because if it's somebody who's doing bone and neuro and, chest and doing breast occasionally, that's a very different read than somebody who's doing breast, let's say 60, 70, 80, or 100% of the time.
Right.
So they have those rights, and it's on our website, www.bremfoundation.org. And women should really know their rights and demand their rights when it comes to their breast health, because they're life-saving. And we have so many women come back to us and say, if I didn't know that, I wouldn't be alive. I really would not have survived my breast cancer if I didn't know what to ask for and what I was entitled to. So I would say, get screened, know your rights, know your risk factors. And what we ask our women to do when we educate women in person is we ask them to screen, share, and support. So the most important thing, if I can leave you with any message today, is to get screened. The second is to share the information with women that you know and you love so that they also are motivated to get screened. And then support the Brem Foundation or local organizations that are encouraging more women to understand what they need and what their risk factors are, so that their relationship with breast cancer is one as a curable disease and not as a terminal disease.
Yes. Perfect. Andrea Wolf, what a pleasure to meet you and to get so much information in such a short amount of time. And I'm glad, as I said, that the tech worked, because we had some lead up to that. And if you send me that information, I'll post it as part of the show notes. So that will be up on the website. And if people just tap on their podcast catcher, whatever they're using, if it's whatever phone you happen to have or your computer, then that will come up on your show notes. You'll be able to get that information really quickly. So thank you so much for coming onto the program.
Thank you. It was such a pleasure. Thank you so much.
Thank you to Andrea for coming on and talking about this really important subject. Now, I know I mentioned it briefly, but my cousin has just recently been diagnosed, and she's young. I mean, she's only 37, so she wouldn't have even thought to start screening, but she was able to find it herself. And this is a disease that's so prevalent, so common, and it's definitely treatable if you find it in time. So please take these things seriously. Even my dad had cancer also. He had a lymphoma, and he was lucky enough to find it early enough. He had a very aggressive type of lymphoma, but he found it very early, and he was able to treat it with chemotherapy. And that was, I guess, more than 10 years ago. And he's perfectly fine. Doing these checkups, these routine medical checkups are so important. Make sure you do your stress tests, make sure you get your cholesterol tested, make sure you go to your yearly gynecological exam. They'll also check your breasts and get your pap smears. Do all of those things. Don't let them fall behind the wayside. Be in charge of your body and your health, not just the day-to-day. We always say you have to sleep enough, you have to eat well, you have to get exercise, but you also have to go to the doctor on a regular basis and get these yearly checkups. Just put it on your calendar, same as you're going to the dentist every 6 months and getting your teeth cleaned. Do these kind of yearly checkups. It can save so much heartache, and it's not really just for you. It's also for your family and for your kids. Make sure that you're taking good care of yourself. And this is something that we have control over. So make sure you take control of your life, take control of the situation. Put these things on the calendar, make the appointment, and just go, right? Don't cancel. Just go, get it done, get that blood test done, get that stress test done, get the gynae test done, get the pap smear, do it. Okay, that's enough preaching. I'm off on a holiday and a work vacation put together. I'm going to New York for a few days. My husband's working in New Jersey. I'm meeting up with him, and then I have some work meetings in New York City with some of the leading Jewish women's organizations, and trying to get some collaborations going for online information and networking, and more summits and more meetings, and see what we can produce. And I'm very excited about that. So that's for 5 or 6 days. I'm going to be in New York City, and then I'm going to Costa Rica with my husband Eyal for a real vacation. It's totally off the grid. We're going to the Osa Peninsula. We're going to be staying in a treehouse in the jungle, and then we're going to be staying in another very similar place, but it's not in a tree, but it's just a wood kind of structure, kind of a hut or a bungalow or something like that, but there's no walls, and it's very close to the ocean, and there's no electricity. We're totally off the grid, and kind of communal eating, and I'll be excited to tell you all about that and what comes out of that, because, as far as moving forwards with your business and moving forwards with work and what you want to do and your planning for the next stages, it's really important to get away from everything and just cut the strings, cut the ties to all your day to day. And this is actually very extreme what we're going to be doing. We're going to be hiking and we're going to be, snorkeling and doing a lot of physical activities, which I like to do, a lot of swimming, and also a lot of relaxing. But all of it is without the internet. All of it is without electricity. It's a bit extreme for Eyal. I know that he's not that excited about that part of it. But he is excited about the nature and the animals and the butterflies and insects and everything we get to do in the turtles and the dolphins and the whales. And it's going to be wonderful. So I'll tell you all about that when I get back. And I don't know exactly what's going to be happening with the podcast. I might miss a week. Hopefully I will not. I might do an episode when I'm in New York City. We'll see what happens with that. In any case, I'm excited, as you can tell, and I'm going to do a solo episode after the vacation and tell you all about what comes of it. So I wish you very well. I wish you a strong and healthy week. And thank you so much for joining me again this week. Litrot.